Welcome to my channel. In this video, we are going to learn about hamstring muscles. We are going to see about its introduction, characteristic features, origin, insertion, nerve supply, actions, and its clinical correlation. Hamstring muscles. Muscles of back of thigh. Muscles of back of thigh are called hamstring muscles. Hamstring muscles include semitendinosus, semimembranosus, long head of biceps femoris, ischial head of adductor magnus. Semitendinosus, semimembranosus, biceps femoris, only long head of biceps femoris, ischial head of adductor magnus. Characteristic features of hamstring muscles. They all take origin from ischial tuberosity. They are getting inserted into one of the bones of the leg, either inserted into tibia or fibula. Adductor magnus reaches only up to adductor tubercle of the femur, but it is included among hamstring muscles. Normally, hamstring muscles have to be inserted either into tibia or fibula, but the adductor magnus reaching only up to the femur, but it is included among hamstring muscles because the tibial collateral ligament, it represents morphologically degenerated tendon of adductor magnus. It represents the degenerated tendon of adductor magnus, which is attached below to tibia. Tibial collateral ligament is attaching below to tibia. Now supply. Hamstring muscles are supplied by tibial part of sciatic nerve. They act as flexors of knee and extensors of hip. They are passing behind knee joint. They cause flexion of knee. Now let's see in brief about ischial tuberosity. Ischial tuberosity has two areas, upper quadrangular area and lower triangular area. Upper quadrangular area and lower triangular area. Upper quadrangular area again has two parts, inferomedial part, superolateral part. Superolateral part, lateral side. Superolateral part, inferomedial part, medial side, inferomedial part. Lower triangular area has outer part, inner part. Lower triangular area has outer part or lateral part, inner part or medial part. From the superolateral part of upper quadrangular area, semimembranosus arises. From the inferomedial part of upper quadrangular area, semitendinosus along with long head of biceps femoris arises. From the lateral part or outer part of the lower triangular area, ischial head of adductor magnus arises. Now let's see origin and insertion of each muscle. Semimembranosus. It arises from superolateral part of upper quadrangular area of ischial tuberosity. Superolateral part of upper quadrangular area. Superolateral part of upper quadrangular area of ischial tuberosity. It gets inserted onto groove on posterior surface of medial tibial condyle. This is medial condyle of tibia. Near the fibula, lateral condyle. This is medial condyle. It inserts onto groove on posterior surface of medial condyle of tibia. Semitendinosus. It arises from inferomedial part of upper quadrangular area of ischial tuberosity along with long head of biceps femoris. It arises from inferomedial part of upper quadrangular area of ischial tuberosity along with long head of biceps femoris. It gets inserted onto upper part of medial surface of tibia behind sartorius and gracilis. Upper part of medial surface of tibia behind sartorius and gracilis. Long head of biceps femoris. Biceps femoris has two heads, long head and short head. Among the two heads, only long head of the biceps femoris is included among hamstring muscles. It arises from ischial tuberosity, whereas the short head of biceps femoris arises from femur. Origin of long head of biceps femoris. It arises from inferomedial part of upper quadrangular area of ischial tuberosity. Inferomedial part of upper quadrangular area of ischial tuberosity along with semitendinosus. Insertion. It gets inserted into head of the fibula in front of its apex or styloid process. Fibula. Head of the fibula in front of its apex or styloid process. Ischial head of adductor magnus. Origin. It arises from lateral part or outer part of lower triangular area of ischial tuberosity. Insertion. It gets inserted onto adductor tubercle. Now supply. Tibial part of sciatic nerve. Actions. They are chief flexors of knee joint, weak extensors of hip joint. They are hip extensors during walking on flat ground. They restrict range of movement of hip joint when the knee is extended. They restrict range of movement of hip joint when the knee is extended. Clinical correlation. If hamstring muscles are paralyzed, patient tends to fall forward because the gluteus maximus cannot maintain the necessary tone to stand upright. When the hamstring muscles are paralyzed, patient tends to fall forward. Now let's revise hamstring muscles. Characteristic features. They arise from ischial tuberosity. They get inserted into one of the bones of the leg, supplied by tibial part of sciatic nerve. They act as chief flexors of knee joint, weak extensors of hip joint. Origin and insertion of each muscle. Semimembranosus arises from superior lateral part of upper quadrangular area of ischial tuberosity. Semitendinosus and long head of biceps femoris arises from inferior medial part of upper quadrangular area of ischial tuberosity. Adductor magnus arises from outer part or lateral part of lower triangular area of ischial tuberosity. Insertion. Semimembranosus inserts onto groove on posterior surface of medial condyle of tibia. Semitendinosus insert onto upper part of medial surface of tibia behind sartorius and gracilis. Biceps femoris insert into head of the fibula in front of its apex or styloid process. Ischial head of adductor magnus inserts onto adductor tubercle of femur. If hamstring muscles are paralyzed, patient tends to fall forwards.